Thank you, Senator. To give you some perspective, the current total budget for for all remaining developmental centers and the community facility at Canyon Springs is projected at $574 million in this current year, and of that, $225 million approximately comes from reimbursements and federal funds. To give you a sense of what the population numbers look like right now, for the closure population, I'm focusing only on that number, not the total population. But as of February 1st, the closure population is 776 individuals. There are 243 individuals residing at Fairview Developmental Center, 167 at the General Treatment Area at Porterville, and 366 at Sonoma. And this total excludes the 200 residents that currently reside in the secure treatment program at Porterville and the 48 residents at the community facility in Canyon Springs. The closure plan for Sonoma was submitted to the legislature on October 1st, 2015, and the department continues to project that we will have housing and services online by the end of 2018 to meet the needs of Sonoma residents. Consistent with the statutory requirements for the closure of a developmental center, stakeholder meetings, hearings, and planning meetings are underway now for both Fairview and Porterville. The department will be meeting beginning tomorrow with city and county representatives at for Orange County for the Fairview closure, and then Thursday, Friday, and Saturday we'll be meeting with employees, residents, and family members at Porterville. As I mentioned earlier, the projected closure for both Fairview and Porterville is expected to be completed by 2021, by December of 2021. As I mentioned, we're in discussions right now with the Centers for Medicare and Medicaid Services to establish similar agreements to the one that we have at Sonoma. Right now, Fairview and Porterville are projected to lose federal funding by April 1st. And so we're hopeful that the discussions will be favorable and we will get agreements in place to continue that funding on. I wanted to talk a little bit about the closure process and when the closure process occurs, what happens for an individual and how it affects them. And the Lanterman Act mandates that an interdisciplinary team develop each person's individual program plan. Now, the interdisciplinary team is made up of psychologists, psychiatrists, neurologists, speech therapists, audiologists, social workers, behavioral staff, their educational staff. There's a whole mix of people that come together to develop an individual's program plan. The plan identifies each person's goals and objectives and the services and supports that will be provided based upon the residents' assessed needs, preferences, and choices. The transition planning process is flexible and will be tailored to each person by the interdisciplinary team. The interdisciplinary team assesses the individual's service and support needs, which informs the choice of community living options. This assessment includes the comprehensive assessments completed for each individual, as well as any additional assessments performed by the regional center or the developmental center. The interdisciplinary team develops plans and strategies in the individual program plan specific to the services and supports the person needs to make a successful transition to community living. Preferences such as where and with whom they live, their relationships with people in their community, and the way they spend their time, including educational services, employment, and leisure, are among some of the considerations that go into the planning. Individuals' participation in community activities and visits to homes are planned to assist in learning about community options and resources. Transition planning is continued through the individual program plan process to include the identification of appropriate residential, medical, day, transportation, and other resources in the community to meet the specific and often complex needs of residents. Individual health care plans for residents are developed and implemented as part of the transition planning process. Effective cross-training occurs in the developmental center, in the home, and at the day program if it's applicable. Once transition plans are completed and resources are available in the community, individuals move into their new homes. And to go into a little detail about the types of resources that we're working on using the community placement plan funds, currently in California, homes with a capacity of over 1,100 beds are in some stage of development. Specifically, the 6 main Sonoma Developmental Center related regional centers currently have 132 residential homes in development and plan to develop capacity to provide housing for more than 400 individuals currently residing at Sonoma. More than half of the developments are specialized residential facilities. Approximately a quarter of the developments are what the department calls adult residential facilities for persons with special health care needs. You'll often hear these homes referred to as SB 962 or SB 853 homes in deference to the enabling legislation. Development of these homes, as I mentioned, also includes new models of care, the enhanced behavioral supports homes, and the community crisis homes. Regional centers are continually developing resources in the community because, as you're aware, people have been transitioning out of developmental centers for years. So there are existing models and existing resources already in the community. Residential developments typically take between a year and a half to 2 years to be ready for occupancy. So a number of the individuals transitioning from Sonoma will likely be transitioning in 2017. The expectation is that population reduction will occur as services and supports become available and placement options are developed. And obviously, the first year of a closure plan is when resources are being more heavily developed in the community, so individuals tend to transition later, in the later years of the plan.
Mr. Doyle, you have 5 minutes.
Oh, I'm sorry. As previously mentioned, resident needs are determined one person at a time through the interdisciplinary team process. And when assessing services in the community, the department uses the following methods. We communicate with internal and external stakeholders throughout the closure. We track the development of new homes and day programs for each person and troubleshoot issues. We meet with the regional centers on a monthly basis to review the transition status of each resident and troubleshoot any issues with home development projects. And when appropriate, we ensure that we work with community services and resources to determine if that all medical and dental services are being developed in the community. I wanted to touch on the issue that Senator Mitchell mentioned regarding the survey that is currently being conducted at Sonoma. On February 17th, the Department of Public Health declared an immediate jeopardy situation. We had an individual who was on oxygen. It was noted that the individual's oxygen tank was empty. The individual's oxygen levels were immediately checked, and they were within the normal range. The immediate jeopardy issue was lifted on February 19th. As I mentioned, we don't know yet the impact of that situation on the agreement that we have with CMS. I wanted to just briefly explain to what is covered under the settlement agreement with CMS. The main requirements of the agreement are the provision of daily programs and interactions as necessary to ensure that the client does not experience any unavoidable decline or in his or her current skills, and the development and implementation of an active program to prepare each client for his or her identified post-discharge setting. And with that, I'll conclude my remarks.
Thank you so much, Mr. Doyle. Greatly appreciate that. We'd like to be able to see if the committee has any questions that they'd like to be able to follow up with this second and final piece by Mr. Doyle. I do have some questions, but I would like to be able to see with the committee. All right. Thank you very much. Mr. Doyle, if I could just ask some questions and just want to get a little more detailed here. And there will be some comments obviously mixed into it. And again, we're really appreciative that you're here. And I do want to take a moment to say thank you, Mr. Doyle. You've made multiple treks over to Sonoma, so we're really grateful for that, sir, and it's always good to see you. The reason why I say that really concerned in regards to this being a fiscally based decision, because in one hand, we say we want what's best for the residents. In another hand, we imply that we have the 3 years. We're going to have to absorb the cost if the feds don't grant an extension, potentially year-to-year extension. At the same time, though, we have never closed a developmental center in 3 years. So I'm trying to determine where we are tracking in this current closure process. So a couple items. I'd like to talk about housing. $8.6 million was allocated last year for Sonoma. That would have created 23 new homes, or the equivalent of 23 new homes. Where are we at on that process of developing those homes, and how many of those have been secured?
The way that process works is shortly after we announced the closure, the planned closure of Sonoma, we began meeting with the 6 regional centers that have at least 10 residents at Sonoma. And those meetings began back in, I think, June of 2015. And at those meetings, we explained they're clear as well that it is a very short timeline. 2 of the regional centers that are involved in the Sonoma closure process were also involved in the Ag News closure process. So they are very well aware of the process. And what we've done is we track individuals, the individuals that are remaining at Sonoma. We talk with the regional centers about the plans they have for those individuals, and then we look at the projects.
So I just want to, so where are we at on that? So the 23, do we have new units that are online, and do we, because what I'm trying to figure out, because we get multiple calls, you get multiple calls about how we're tracking on progress and how we can track when this goes into budget about where we've been with the $49 million that was expended last year to be able to invest it this year. So when we take a look at where we're going for next year, we know we can track where we've been and where we need to be able to go. So do we know out of the $8.6 million that's been allocated for Sonoma, $18 million for Porterville and $22 million for Fairview, how many units now are online and ready to go?
Yes, we track that information by regional center. We know which types of homes need to be developed based on the individual assessments that are done of the residents. And
So do you know how many out of what is needed in Sonoma have now come online?
I don't have that number with me, but I can get that number to you.
That would be great. Because that's I know, a question that we get quite often. So I'm just creating a little bit of a parking lot here for follow-up. So we'll follow up on homes. Would like to be able to talk about the ICFs, the care facilities. The state used to have 2. We currently now just have 1, 56-bed facility in Cathedral City down in Southern California. And then because of budget reductions during the recession, we closed the one up, I believe, in Yuba City, which had additional 56 beds. So we've always been able to turn to other developmental centers when we've looked at closures to be able to take the most medically fragile and potentially transfer them into another developmental center. We're not going to have that. So tracking, let's just say it's 2018, I have still a challenge to be able to understand how we're going to get there, because I'd like to be able to hear, after we're done, after talking about this, what is the biggest difference that we're going to be able to close in 3 versus 5, because I'm not sure. Where's the department on an additional ICF in Northern California?
Well, I think to address your first question about the timing, one of the things that I think will give us assistance in closing Sonoma more quickly is the lessons that we've learned from closing the other developmental centers. We've developed 2 new models of homes that we think will be beneficial in transitioning individuals, because we know that at the developmental centers, the residents that remain typically have either challenging behavioral issues or significant medical problems. And we think between the combination of the medical homes and the enhanced behavioral support homes, we think those will be effective in helping us move individuals into the community more quickly.
And even though we've lost 435 since 2011?
On the ICF beds, a lot of times.
Well, I know the ICF, but I'm just saying on the tradition. So let's just say we're transferring in, because I think you're talking about lessons learned, and there's different models of homes that we have now that we did not have in previous closures.
Correct.
And what we know is because of the recession, we've lost 435 residential facilities since 2011 out of the regional center system.
That's a number that has been reported. That's correct.
And so that's what I'm just trying to get at is, while we're trying to add units on, we also know that we've seen a significant number of units taken out of the system because of reimbursement rates, quite frankly. I mean, that's what we continue to hear from vendors. So I'm just trying to determine where it adds up. If we're saying we need 23 new homes, X amount of units just for Sonoma, despite the fact since 11 we've lost 435, and I'm just trying to track where we're at on homes lost because of reimbursement rates and homes that we're going to need to be able to bring on for all these individuals that we're trying to be able to transfer out in the community, and how that all matches up.
Well, I think it's important to note that some of the homes, while they, again, the number of homes lost, number of providers is not a number that the department has represented as fact. It's a number that we're aware of. We've heard this.
You have a number? Does the department have a number?
Well, what we see is that while homes are lost, a lot of times providers move to a different level of care, so that I'm not disputing that homes are closing. That's a fact. But in some circumstances, the providers do move to higher levels of care where, as individuals' needs change, they're able to move to a higher level of arm rate care. And in the meantime, we are, as I said, in addition to the resources that we're developing for the closures, we also are on an annual basis, we have base funding for our community placement plans, and we are developing homes on a regular basis so that some of those homes also become available for individuals who are transitioning from the developmental centers. So we do believe that based on the additional resources we've received, we will have the housing in place in time to meet the closure deadlines.
And just adding to that, I know what you had said is that there's some challenges in regards to recruiting of employees into the developmental centers. I think that's what maybe the secretary had said. What my understanding is that if you compare pay rates in many cases, developmental centers actually has a higher pay rate hourly basis than what a regional center would have. And I think that's some of the challenges that a lot of advocates have. And the reason I say that is if we're having a challenge recruiting for state jobs, and my mother-in-law operated a group home for autistic men for 2 decades, the best she could pay is $12 an hour. So I say that is that we've lost 2,300 beds, and we're challenged with reimbursement rates just on the regional center side. So and I know I'm a layperson here, but how this all adds up, that we're going to have enough of a facility to be able to keep facilities in so there's not additional transfers once someone leaves a developmental center.
Yeah, and we understand the problem of the difference in what state employees are paid compared to employees in the community. We think that this is something that we're hopeful that as the Secretary mentioned, the managed care organization assessment will help address. Part of that includes increases for individuals working in the community. We also recognize that we have to find some ways to make hiring state employees more attractive to local providers. When with the Ag News closure, that was done with providing enhanced rates. And so, we have to look at what's available and what is possible as we move forward.
And because because I know that's where the department wants to be able to go, is looking at 2018. So we're 2016, and as we know, life flies, right? So when can we figure a state staffing plan may be presented as far as strategy? Because the concern that we can continue to have is the longer we wait to be able to present a plan, the more employees are going to exit those 3 facilities that are currently existing right now. And then we lose them. So we've been talking about this in depth for about 2 years now. So when do you expect a state staffing plan to be able to come forward?
We're hopeful. We're working with the California Human Resources Department, and they've been helpful in, directing us on what kinds of strategies may be effective in helping to retain staff and looking at options as staff, if they decide to move into the community, what might be possible. But as far as a timeline, we're hopeful that it will be in the immediate future, but again, it's based on internal discussions and what kinds of things are possible from a budget standpoint.
I'm going to go to where Senator Mitchell was talking about and just get into the issue of seasons. So are we thinking spring, summer, something like that?
Unfortunately, Senator, I'm hopeful that it will be, sooner and in the spring, but, until we have the details worked out, I can't give you a definitive timeline.
And again, I'm just going to keep coming back to this, and I know there's a dead dog underneath this desk that's getting kicked. But, my challenge is we are advancing a plan and expediting a plan in 3 years. We have never closed a developmental center in less than 5. We don't have a state staffing plan, and what we know is that individuals are already leaving developmental centers trying to find other jobs. We know that right now.
Absolutely.
We know that real estate is expensive, particularly in the Bay Area, and there are some real challenges with that issue as well. And we also know, even with an MCO tax deal, that we're still low and we're still going to be at the bottom when it comes to spending on development disability individuals. So I think that's really want to be able to get out of this. What I was hoping is that we're looking at state staffing plan spring or summer. I'll follow up with you in regards to number of homes, but I'm just trying to get some detail in this because I know that's where the stress is with the community.
Sure, and appreciate that, and we understand that as well. I think the concern is that these things, particularly issues related to employees, are again part of the budget and the bargaining unit process, and those are things that we have to, we're continuing to work on. We understand the urgency, and we do understand the concern that has been raised. We hear it from employees as well as from family members at Sonoma that they are concerned that we are, going to lose good staff to other employment. So we're aware of that and are working towards a resolution.
Okay. So then that continues in regards to centralized skills, and we were talking about dental and the cobbler program, as Mr. Monning was pointing out. So being able to keep those specialized skills, I'm going to go back to my mother-in-law. The only sedation dentistry, particularly those and higher in the spectrum when it comes to autism, was being able to utilize the services at the Sonoma Developmental Center. So if we lose that, those who are in the community and those who are at the developmental center, those residents, are the ones that are facing the challenge. So that's why time is of the essence to be able to move this. And that's why I'm still trying to figure out how this is different. If we've known what has worked in the past, why can't we implement it now?
Well, I think that's what we're doing. We're working towards the things that we know have been effective. We're working towards those things. Our plan is to keep, the dental clinic open at Sonoma so that individuals will be able, if they need services that aren't available yet in the community, they'll have those. But in addition, we're working with the regional centers to develop those types of services. So that's one of the proposals we're looking at, is a dental clinic in the community. And it again would be part of our CPP funding, but those are things that, we're aware of, and we understand the concern, given that you're right, we're 2 years away from 2018, and there is a lot of work to be done, but the regional centers are doing an outstanding job of working with us. We're communicating frequently on the resources that are needed. We're working to develop things, and as problems come up, we're working to resolve them.
I just have 3 more, and I just like to go to previous closures. When Agnew's closed, there was a collaborative project that was called the Bay Area Project that brought all sides together to be able to talk, what my understanding is from regional centers, residents, the Family Advisory Committee, to be able to have a conversation in real time about issues. And it seems like it's been left up simply to the community to be able to do this, at least at Sonoma. I don't know about Porterville and or Fairview, but wondering if DDS is going to be advancing these similar forums for each of the closures in each of the regions.
Yes, we've been working with the Sonoma Coalition, with the Parent Hospital Association. We've heard their concerns. We've listened to the issues that are important to them, and we're working towards trying to meet some of the needs that they have, some of the concerns that still exist. And, part of that is ensuring that all appropriate parties are involved in the discussions, and that there is a focus on what is needed, because the closure of each developmental center is different. For example, one of the things we found with Porterville was that while Sonoma and Fairview have very strong parent hospital associations, Porterville doesn't have one. So, our plan is to go down there and meet with the families this weekend to talk about what the closure, the details of the closure.
I guess it's just been inconsistent, because this was implemented at Agnew's and was not implemented at Lanterman. And so, but it worked really well, particularly on the issue of housing. And housing, particularly in the Bay Area, is such a bugaboo because real estate is so expensive, whether it's just the price of dirt and or buying the home as well. And so if if you're saying the department is going to be able to expedite because we've learned what's worked and frankly what hasn't, I'm challenged to understand what we're implementing at Sonoma with what's worked in the past for the department. So what is it that's worked for the department in the past that we've implemented here?
Well, we've, we have the quality assurance groups that meet to make sure that transition is going well. Family members are involved in that. We've, as I mentioned, we've got the new models of homes that we know are needed, and we're implementing those. We've got the medical model homes that worked well at Agnew's. That model is continued on, and and again, we know that we have work to do in the area of community state staff. That worked well at Agnew's, and we need to make it effective at Sonoma as well.
Is there anyone on the team that is here today that can talk about how many units now are online for Sonoma developmental staff, of residents?
Let me check. Yeah, we have somebody who has that detail.
Okay. Good afternoon. It's good to see you again.
Hi, this is Tiffany Andrade from DDS. I want to first understand your question regarding the projects that have come online so I can properly answer it. You're referring back to some funding amounts.
So my understanding, correct me if I'm wrong, $49 million was allocated in last year's budget. In particular, the majority of it, I believe 47 or 48 million was for funding, for housing, and for additional units. And my understanding is that 8.6 million was allocated for Sonoma. That's what we have from budget staff, so I just want to make sure that we're on the same page, tracking the same page.
We're good up until the 46 million. That amount of money is specific to supporting the 6 regional centers for Sonoma.
Okay. So majority of it was for housing, correct?
Correct.
Okay. So how many units are now online?
Well, between the funding that was put in place, the 46 million, in addition to the regular CPP funding that those centers had received annually, that makes up a total of 132 homes that are in development.
And I'm not...
Many of those were brand new to the approval process. Therefore, those providers and nonprofit housing organizations have been selected. Homes are being sought out right now. So to answer, I think, your question about how many of them are open, that would have been some of the homes that were already in the process of development in previous years because of John mentioning that it takes 1.5 to 2 years for a home to come online.